Hello, I'm Dr. Dean Bonlie from Magnetico, and your magnetic moment today is about arthritis. When we first invented the magnetic bed, we tried it on about 100 people with arthritis. 96% of them had a relief of pain, and 38% of them were completely cured from their disease. So they thought, this is pretty wonderful. So we actually started making them stronger with even better results. Not long after we were started, also a couple came in bringing their 13-year-old boy. He had what's called juvenile arthritis. This is usually caused from genetic problems, but this little boy was in a wheelchair, his growth was stunted, and he ached all over. He was on strong narcotics for the pain. So we said, well, let's see what'll happen. We put him on a magnetic pad. 2 months later, they came in and said, this is fantastic. He's joined the baseball team. I said, really? He can run? Yeah, he's not in a wheelchair anymore. I said, how's his studies doing? He says, they're going great. He's went from D's and C's to B's and A's. I said, well, that's wonderful. I said, let me know how he's doing. So 6 months later, they came in. I said, how's he doing? He's in a growth spurt now. Instead of being stunted, he's catching up with all of his peers, and it's just wonderful. So this is by the way, we had treated other people with problems with growth, not enough growth hormone, so they were stunted, and the growth hormone kicked in, and they began to gain their normal genetic height. So what are we doing here? We're just making all the chemistry in the body work better by the Lamar formula, which tells you that the stronger the magnetic field you're in, the faster your valence electrons are orbiting the atoms of your body, and so they get more charge on them, and this leads to electron transfer, which is the basis of all chemistry. So all we're doing is, when you lay down on a magnetic pad, it's acting like a big catalyst to the chemistry in your body. And not only is it good for arthritis, it's good for a lot of things. Now, arthritis is primarily caused due to undigested food, simply because you're not making enough digestive juices to digest the food properly, and that's a weakness either due to eating too often, so they're wore out, or a genetic deficiency in making digestive juices. So the undigested food gets into the small and large intestine. It actually rots and puts out a huge amount of toxins, and those toxins go into the joints, and because that's where the porous circulation is, and the body tries to wall them off, and you have an inflammatory response. So there's things you can do. You can space your meals 5 hours apart. Don't eat anything in between meals. Don't eat before you go to bed, and get on a magnetic pad, and you'll get well.